Okay,
There we go.
okay, I'd like to call the Ways and Means meeting to order, if I could. Roll call, myself, Elaine Daly, Jonathan Anna, Brian Muldrow, Heidi Nightingale, and Ben Vitale. Could I get a motion to approve the September 17th minutes?
Move it.
Nightingale, second.
Okay, any questions? All in favor?
Aye.
Aye.
Okay, we don't have any appointments on the agenda at this point. So we also have 3 resolutions for Ways tonight. If we want to start with the, well, let's go and talk to all right, we can start with our treasurer. He also has a resolution on the agenda tonight. Dave, if you want to, it would be WM3 is on the agenda tonight. And that would be to authorize the county treasurer to fill an open real property clerk position in the treasurer's office.
That's right. We just had somebody approach us last week, gave us 2 weeks notice. Sally Bronson, she's been with us a long time. She decided to retire, which is great for her, but it kind of puts us in a lurch. And we have some foreclosure things and things coming on this week, next month rather. And so we would like to fill that position as soon as possible. And because we didn't make the reservation deadline, we had to bring it in to you, call you and bring it in.
Yeah. Well, can I get a motion in a second and we can have some discussion?
I'll make the motion. Muldrow, second.
Okay, this is to fill an open real property clerk position in the treasurer's office, and the individual who's resigning is a principal account clerk.
Right.
So I was trying to get some additional information on this, and you had a real property clerk, a position available, but it wasn't funded. That's why you don't have to create this position.
Okay.
You're asking to unfund the principal account clerk, use that funding to fill a real property clerk. That's correct. And in here, it talks about that the principal account clerk position would be unfunded to accomplish that.
Okay.
My understanding is the real property clerk is the grade 10. The principal account clerk is a 12 or higher, Diane?
Yes.
Okay, so that's why there's language in here. At this point, this would be a savings. But we have been basically abolishing positions that we've been unfunding. And if the committee chooses to take that action, if at a later date, you want to promote someone from within and you have another principal account clerk position on the books that isn't funded as well.
Right.
Okay, so,
We have to hire this person with civil service. We're working with them now.
Yep.
To see how many people are on the list. If they haven't have 5 on the list, we have to hire from within there.
yep.
We're waiting to hear from them as soon as we can.
But basically you want to fill a real property clerk and unfund a principal account clerk to do that.
Correct.
Is there any questions from the committee?
Why can't we abolish it?
We certainly could if if we wanted to amend this resolution to abolish that position. Since we're unfunding it, we could certainly do
I'll make the
that.
motion to abolish the position.
Yeah, I'll second.
Okay. Any opposition to that?
You're reading.
Okay,
Amendment.
to the amendment, yes.
Correct.
So we need to
Vote on the amendment.
vote on the amendment.
And resolution as amended.
Okay, so can I get a yes for the amendment to abolish the position?
Yeah,
Aye.
Okay, and now could we get a motion to approve the amended resolution which abolishes the account clerk, principal account
I already
clerk?
have the motion.
And a second? Okay, all in favor?
Aye.
Aye. All right. Yep. Anything you want to add, Dave, to your information?
Only that I try to keep up to speed on transfers of monies and so on. And I mentioned the last meeting, I remember that our interest rates now are starting to decline. And we parked some money this last week to try to keep the highest rate that we can. And as these significant transfers take place, I'll make sure that I make everyone aware of them. But we want to try to optimize obviously as we can. Maybe scouring around, looking at all the banks and CDs and New York class that we have a lot of money in right now. And different certificates of deposit, both in 6 months and year increments. And so as they develop, I'm sure I keep everyone posted on that.
Great. Okay, any questions for the treasurer? Thank you. Grace, you don't have any resolutions, but you do have anything to add to your report?
Just a couple things to just highlight. I know for the last few months, I've had the county audit on my report. So I'm happy to say that we finally finalized the county audit and we'll get the federal audit. So we've met the deadline. That's been completed. And the other thing I wanted to highlight, I sent out an email this morning on the sales tax. I don't know if everybody was able to see that, but we were up for October. October was a reconciliation month. So that brings us up over last year, same time, 1.86%. So good news there. Hopefully it'll continue to trend that way for the rest of the year and would kind of close that deficit a little bit that we have with the budget and sales tax.
And I appreciate your clarification that instead of being 1 million under budget, we're now looking at 800,000 under budget. But if it trends upward, it might even reduce from there.
That would be
Okay.
good. So
Okay. Any questions for Grace? Okay. Jenny, you do have a resolution. Which is to adopt the equalization rates for the apportionment of the 25 county tax levy. All right, and that's a routine resolution that you do.
It is. Especially the state provides with the certified equalization rates, and so we're just adopting those.
Okay. I had a side conversation with Jenny because I remember we spoke before in the city of Auburn was at one point at 96% assessment. It's now at 88. And your explanation, if you could go over it?
Sure. So essentially when towns and city don't reassess annually, when the market continues to appreciate and their assessments are staying the same, essentially that equalization rate. So they're further away with that assessment level staying the same and not changing every year. They're further away from what the market sales actually are.
All right.
We were paying, basically, if somebody's paying 100, if 100% would pay $100, 58, where I live in Sterling would pay more than $100 to make up for that gap.
So when we use the equalization rates, we're just using it to apportion taxes between different municipalities. When you actually apply the tax rate to the bill, it's being applied to their taxable value, not the full market value. So yes, the town portion would be based on that equalization rate. So the full market value would be increased based on that lowering the equalization.
Kind of make the equalization
Yep.
makes things even.
Right,
Yep.
it brings everybody up to the same level. So it's an equal and fair distribution of the county tax.
Yep. Okay. Did we get a motion and second for that?
No.
Can I get a motion for that WM1?
Move it.
Second? I'll second it.
Aye.
All right. Any other questions? All in favor? Great.
I mean, stuck in that 580.
Yeah. Okay, and anything you want to add to your report?
I just wanted to highlight my first bullet point. So I was contacted by the Village of Fairhaven, their attorney. There's a couple properties that they've had an exemption on that fall outside of the Village of Fairhaven. They're within the town of Sterling, but not within the village. So in the past, those properties have had an exemption on them. There's a new assessor for Sterling, and so she's been reviewing the exemptions that are on properties, and there's no documentation that the county has approved exemption for these properties, a municipal exemption, which if you are agreeable to it and do so in writing, they can get a municipal exemption because they're used for water purposes. So next month, I am going to bring forward a resolution for you to consider to approve exemptions for those two properties, as a request has come from the village.
They've been getting them all along.
They've been getting them all along,
No.
but like I said, the assessor, in
I
reviewing
don't think
things,
they
she
have.
has to make sure that there's appropriate documentation to support any exemptions that are on properties. And so without having that documentation from the past when they initially were put on, which they've been on there for a very long time, I couldn't tell you when they actually were put on.
Did you talk to Becky?
This is what Becky would need in order to.
No, is that who you spoke with? Or did you just speak to the village? Because my understanding is those properties haven't been exempted. The town denied their request and it has not been exempted.
So in prior years, it had been exempted, correct?
But this year they denied it because they didn't have this action.
Correct. So if you were to say that you are agreeable to them getting an exemption from the county, then the assessor could put that exemption on for the county. The town would also have to approve an exemption from the town. And the school district likewise would have to approve an exemption for the school. So anything that falls outside of that district boundary, they've got to get approvals for exemptions. But it does fall within the purposes of use where if you are agreeable, they could get an exemption.
Okay, and you'll bring a resolution next month for,
Yes, next month I'll be bringing a resolution for that.
okay. If we'd like to, maybe we can get through the last resolution. I'm not sure who's presenting this, but this is WM2. And this is authorization to pay the city of Auburn for reimbursement of HVAC engineering costs at the historic post office. In reading through it, it looks like that project is not moving forward and the city had invested in doing that, and this will repay them. The only question I had is, obviously, this was part of the money that was allocated by ARPA, but then pulled back into the budget. Anyway, Lynn, when we did that resolution, or no?
I don't think this one was pulled back in,
Okay,
that this was still gonna be a project that.
say that again?
I think this project is still, the HVAC still has to be done. We're just
Okay.
not moving forward with with the city at this point. I don't believe it was one of the ones that
Okay,
I mean, we didn't take back all of the money in every project.
okay,
So what, I mean, really, this was the county's obligation. Gary had them do additional work during this time, that they had to do with our HVAC portion of the project. And so that's where this bill came from.
and they were gonna do it on behalf of us, and they were gonna remodel the space, and they were gonna do all of that until everything went bad?
I'll
Not the
move,
HVAC, the
Okay,
HVAC
all
was
right.
always something we were gonna do beforehand,
I'll move it.
and then we were gonna do it together.
If I may shine a little light on it. So the story that I heard from Gary was that he went through and had the HVAC system engineered the way it was gonna be, and then the courts came in and said they're gonna remodel the space, and so when you move walls and make things different, it means you have to re-engineer your HVAC project. So Gary put it all on hold for now, but it does need to happen.
There's a motion by Ben. Gonna get a second?
Second.
Other questions?
Yeah, I was gonna say this before Tony got up, but I'd like it, Public Works, if Tony could give us a update on where we are with this and what the real plan is and things like that, so that we know kind of where we're going.
So my plan right now with the bandwidth that I have and the projects that I'm doing, you want me to expand?
No. That way, that the next committee meeting will be fine. Thank you.
Okay. We'll support this resolution. All in favor?
Aye.
Aye. Opposed? Great, okay. Lynn, before we move on to HR, it's my understanding you have some information that's been requested about the spending of the first $500,000 that we put aside for the building.
Yes, I put together a summary. You can imagine there's been quite a volume of invoices that we've been paying. And some departments have even, they've been spending some money out of departments, not just the 500,000. So this might look like we've overspent, but that would be why, because some people are obviously just spending So some of their own budget money, but we're keeping track of it for insurance purposes. Here.
The post is there? God.
Can they have one, Lynn? Do you have an extra?
Is it way in the back here?
Then do you have an extra or no? I can go back.
I do not have an extra.
That's okay, I'll come back. Thank you.
I don't have it. I gave it to these guys. This is summarized a little bit for you. I'll just go through it and walk you through it a little bit. IT costs are, the most significant ones that we've had. Social services, I've separated them out because I did end up charging that over to their account. We moved the expenses over there so that they could, end up claiming those. The other departments are about 42,000. A couple departments are small, real property. Haven't spent too much. It's nice. Treasurer, same thing. These are funds kind of came directly out of their accounts. So we didn't buy furniture, but we didn't pay it out of their account. Social services has paid quite a bit. 55,000. B&B, a small amount, county clerk, finance. Like I said, those were all out of their own departments, just a little bit of money they've spent, a couple thousand each. 911, it was really those laptops, the backup ones that we bought that went over to our department in Moscow. On the back page, under the purchasing department, so we had a lot of purchases being processed by Amanda, and we were putting them through our main account that we were using to track the expenditures. There we have expenditures for the furniture that we did have to get for really the finance and treasurer, and some over at State Street to get the temporary walls that we've got for the EMO department that they're using out at the public safety building. We have office supplies, obviously a lot of that. We didn't have any of that stuff. That would include paper or just your basic setup stuff that people would need. IT, some miscellaneous here. We've been handing more spending on just some smaller things, a lot of hookups, cables, things like that. Buildings, office where social services is located, so they had to be all hooked up. Then we have a category that I'm calling management. It's kind of like the overall stuff that we've kind of had been spending for the county. That's where I'm putting like some of the environmental testing, the asbestos, the rent that we've incurred, a couple of departments, since obviously they wouldn't have that in their budget. Collier's environmental consulting, that's stuff that we were kind of doing earlier on in the beginning phases, and some other miscellaneous items. And then we have some commitments down here that we haven't spent yet, but we've passed some resolutions. We still have some probably ongoing with Collier's for that initial environmental investigation. And then the resolution that you did just pass recently for the investigation portion of it, that's $86,000. So those ones on the bottom, we haven't actually spent that yet, but they're kind of lingering out there that we probably have some bills that will come in. There may be some attorney bills also that I haven't probably seen yet, that we've been using a lot of consulting with that. So we added up and we have spent over 500,000. And really that's probably because we've spent some departmental money also within social services, within IT. I moved some of the costs, but some of it still kind of sat in the IT department. So we've actually have spent and committed all the funds we've already had given to us.
And at one point, there was another resolution potentially looking to be discussed for another 500,000, but that didn't move forward. And we're bringing resolutions now for other spending. How did we leave all of that?
Well, I think there's still enough money in the initial resolution for the 500,000. As Lynn has indicated, 116 is earmarked, but hasn't been processed yet.
Right.
Right.
Right. So we haven't brought anything forward that could fit within this. So it's just gonna be things in the future. As we move forward, I guess we'll need to get more funding as the projects continue to develop. Or if someone else gets relocated or anything like that, then we really wouldn't have.
Because I had thought the last two resolutions we just passed for the air testing, and then we're the balance of this 500,000. That's kind of what you're saying?
Yeah, it's in there. That's
Yes.
investigation.
Yep.
This
Okay.
one that's on here.
Yep, and that would kind of get us to the 500,000
Or a little more.
Over.
or a little over. Yep,
Yeah,
Yeah.
five
Like I
twenty-six.
said, people have been spending some of their own departmental money.
Yep.
To get some of the things that they needed, especially right when we were immediately dislocated, in June. That we didn't have any money given to us, that we didn't have a resolution.
No,
passed, so
no
people were
resolution.
having to kind of set up ad hoc. We spent some money out of their current budgets for that.
appreciate this.
Yep.
Thank you. Any questions for Lynn, from anybody? Thanks, Lynn. Diane? Hi. Hi there. This is part of the data we have here is part of the quarterly report that you're
Yes.
doing in terms of your outreach
Correct.
and, you know, who's applying for jobs, who's taking them.
As you can see, our application numbers are down a little bit this year. But hopefully that'll start picking up again. It really just depends on the amount of the exams that we have posted and how many positions we have open.
Okay.
So I would also, since sending in my report, we have met with our consultants who have been doing our compensation study. So phase 2 is completed. We have a preliminary report on that. The findings are really good as far as the majority of positions are within market based on the range that they gave us for that. So we do have a few positions that we do have some questions about, so we'll be meeting with them again to discuss those.
And getting those answered before you make this available or discussed with the county legislature?
Yes, and then once we have all that information, we can send it to the full legislature to let you know how it came out.
Okay. Thank you. Any other questions for Diane? All right, thank you. And last but not least, always, Amanda.
I don't have anything to add, just that, there were bids that are listed on here that I'm also working on. But that aren't ready to go to the public yet. But if anybody has any questions on anything?
Any questions for Amanda this time? Thank you.
Thanks.
Okay, that, we did the 3 resolutions. Now we can go on.
Actually, I do. I have a question.
Okay.
What is the Cayuga Gold meeting?
So it's like, there's a committee that tries to do some positive things. I'm part of the committee, so like we did, an end of the year party last year. We had, you know, baked goods and things like that, and we did a health fair. It's just kind of like an employee outreach, a positive type of an environment to help with morale and things like that. We're working on, we had to put that on pause for a little bit with the closure. And then now we're working on bringing that back and trying to do something for the employees to kind of boost.
Are there awards actually? Do individual employees get awards?
Yeah, it's quarterly, right,
Mhm.
that somebody picks quarterly. Yeah, and then at the end of the year, there's, you know, a recognition party, essentially, and it's just kind of like a fun thing to do. It's like a nice thing to break up all the other stuff.
All right. Heidi, want to go through your resolutions?
Yes, Madam Chair, Health and Human Services has 10 resolutions. I'd like to start with bundling those that have to do with contracts that are ongoing or based on new funding sources. HH1, HH2, HH4, HH6, and HH8.
Madam Chair, I'd like to separate HH4 for discussion.
Oh, yes, thank you. Yep, remember to keep that separate.
So
I'll motion for 1, 2, 3, 6, and
Second.
no.
So HH1 authorizes the chair of the legislature to sign an agreement with a qualified company to provide appropriate certified lead renovation and repair services to qualifying homes in Cayuga County through our health department. And HH2 authorizes the chair and the Commissioner of Social Services to enter into a contract with Cayuga County Mental Health for reports and assessments on children that may be in line for residential treatment programs. HH6 authorizes the county legislative chair, the legislature chair, to the Director of Community Services to contract with outside agencies in order to carry out the system of care expansion and sustainability in schools. This is the DBT grant that they have been working with for about over a year now. And HH8 authorizes the chair of the county and the director of the Cayuga County Office for Aging to sign an MOU with Alzheimer's Disease and Related Disorder Association Incorporated to provide services as a caregiver support initiative.
you made the motion for those?
Yep, we got a
Already
motion in a
did.
second, yep, for 1, 2, 3, 6, and 8.
Okay,
No,
No, 3 though, correct? It's 1, 2, 6, 8.
Oh, 3.
Oh, I'm sorry, 1, 2,
1, 2, 6,
6, and
and 8.
8. Correct, I marked 3, I pulled 4.
okay. 1, 2, 6, and 8. All in favor?
Aye.
Aye. Opposed? Great. Thank you.
HH3 is amending the social services 2024 budget to accept state funding from the shelter arrears eviction forestallment safes program. This is monies that will allow the Department of Social Services to help pay landlords the arrears that may have come from tenants who would otherwise be at risk for eviction and homelessness.
I'll move it. Can I get a second?
I'll second it.
Okay. Any further questions about accepting those funds? All in favor?
Aye. So HH4 is the authorization for Cayuga County Mental Health Center to contract with Qualifax Systems Incorporated. We've been notified for a while that the current telemedicine, or not telemedicine, but the electronic medical records program that mental health is working with is going to be losing its life, be out of date. And they did some quote work and chose Qualifax for 2 reasons. It is, and there's another county, it's in New York State that's using it as well, Cattaraugus. It's or they're gonna come on board in November with it. It's there's 2 benefits to this over the other quotes that they received. Number 1 is that this is particularly an electronic medical records software that specifically has specific abilities to keep our social workers in compliance. There's lots of the mental health social worker compliance, state compliance issues built into it. But importantly, also, there is a piece of the software that integrates billing. And as the deputy director and the director who is on maternity leave now did the research, those 2 pieces were the compelling pieces that made this the software of choice. The integrated billing will allow us in future to abolish a billing specialist in mental health. There is not a specific date to work with that. Should this be approved and we go with it, there's going to be like a period of time, I think it's March we're looking at. I'm looking for March.
Optimistically March to April.
And that's like when you've got both programs sort of side by side to do integration. And then after that integration is done, looking at what is happening with the particular billing specialist in that position now, who is actually in her master's in social work program and wants to move over to work as a mental health social worker for the county. So there isn't a specific date that we can earmark for the savings of that $68,000 position. In my discussions with mental health, they felt like August 1st would be a reasonable date to look at. That's a, not a full year salary, that's a quarter year salary in 2025. So we wouldn't be looking at that $68,000 savings from abolishing that position fully until 2026.
She said. Oh. Okay, I guess there was some discussion after the HHS meeting about involvement and, whether there was an RFP and was Amanda involved, and did you get involved after that time, Amanda? And there's been some.
After the meeting?
Yep.
Yes, yep, and I've been working with the vendor to try to negotiate some pricing. We know we've at least identified $1,000 savings. And I'm working to negotiate the annual percentage increase to go down, match other counties, from 5% to potentially 4%. I pushed on 3.5, so we're still kind of going back and forth a little bit. And I give them, we need a final answer by Monday. Before we go into our full legislation meeting. So we have identified at least $1,000 savings on it. So I've been working on this as well, yes.
What's the time frame from the time you purchase it to the time it's up and running is what?
I'm anticipating anywhere from 2 to 4 months. You're talking about complete overhaul of data migration, and that we don't have an exact estimated time of how long the data migration process is going to take, as well as staff orientation on the new software. So we'll be training therapists and other providers, billing staff, as well as compliance.
And the old software is no longer going to be supported. Is that what I'm
November
understanding?
1st.
Is it November 1st you lose support?
Yep, they'll be no longer doing necessary upgrades, and it's pretty much extinct.
Okay. And as far as this whereas about the anticipated vacancy, well, that's we talking August? Is that what I'm hearing?
I don't have an exact date. I think maintaining the biller in the transition to outsourcing the billing is something that's really important to us. This is going to be new, and there's going to be a lot of kinks to work out. So our current biller has a great amount of expertise in understanding all the nuances to New York State behavioral health billing. So we can't give an exact timeline.
So is this the position that's going to go to a different position? Is that the vacancy?
Yeah, eventually, yes.
Not true.
I guess from the question I had was, you're trying to make the case that you will not need a position as billing specialist once this software is fully integrated, because it will do the billing on its own.
It's outsourced through the company, yes.
And this just made the resolution look sweeter, like that you could get rid of. I mean, that is your intent at some point, but it's not imminent this position is not going away anytime soon.
Yeah, I mean, it's hard to just know
Mhm.
number or
the last time I think they did a software change was probably 12 years ago.
Yeah.
So we don't really know what bumps in the road to predict and kind of the timelines.
Right.
And it's hard to commit to a timeline when we're just kind of preparing for some bumps and knowing that there's going to be some challenges.
And again, this software certainly was not the most inexpensive by any means, but it meets the needs of the department.
Yeah, and I think from a long-term planning perspective, to be able to outsource billing within the company that's providing the electronic record is a huge bonus to versus if in the future we were to look at outsourcing, we would have to look at a different agency or company to do that. So it kind of just simplifies the process quite a bit on a long-term perspective for mental health.
Okay. Any other questions? Okay, we have a motion and a second. Yes, all in favor?
I didn't get a motion in a second.
Oh, okay, can we get a motion and a second for this?
Like, move it.
Can I get a second or? Okay, he's thinking right now.
More than me.
I mean, basically, that was the point that was made. There was not a lot of involvement. There was a waiver given because the department really had to look at what their needs were.
Well,
That is
in
justifying,
our purchasing policy,
Yep.
when it comes to, so software fits under the professional services.
Yep.
The New York State Tax Code. And they have two choices within the Cayuga County purchasing policy. So if your bid threshold is 75,000.
yep,
And when it exceeds that, you either have to go out to bid, or Cayuga County has this special alternative in there where they can opt for a chair waiver.
mhm,
So the department made that choice to go with a chair waiver, and what their justification was, that was up to the department. So by getting one executed, it is compliant with Cayuga County's purchasing policy. So each department, it's situational, they have different reasons to use the chair waiver. So they had their reasons that they chose to go forward with it in that respect. I gave the option of, these are your choices to keep it compliant, but I had no other information to go on. It's made it clear that we need a better process for this. If we're going to utilize a share waiver as an alternative to going to bid, that we probably should have some kind of steps to get to that point, rather than me seeing it after the fact and things like that, so that we can avoid these types of situations.
and if we were to,
Annual cost is 230.
yes, they could say that out loud.
I mean, the recurring cost is every year is 230,816 with a 5% annual increase each year.
So that 5% too, I've met with the vendor and have been trying to go over the proposal. And I know Maureen's been included in that as well. That 5% is only on the user licenses. So that's not on the entire cost of the system, because it's doing script writing, it's doing telemedicine, it's doing invoicing, it's doing so many different things that the proposal is broken up by all these variables. And that annual increase you see is only on the user fees, which is $67
When I'm
a
reading this
year.
right, it's $230,000 each year for the rights.
To use the software.
Is that correct? Am I reading that?
Yeah, I
right?
mean, the estimate is, it could vary a little bit depending on how many, invoices because they're paying per on some things, so it's an estimate, but it's a pretty accurate estimate of what they expect it to be. Yes, but the 5% isn't on 230,000. The 5% is just on the user fees, which is $67 per user. They've
I think there's
acknowledged there's
44 to
about 44
47
users. So the 5% is on that.
Amanda, what was the second bid? Like, what was the second pricing? Like, was there a big difference between you said this was more expensive?
This was the most expensive
How close was the
option.
second one?
I can clarify. So when you look at the bid for Qualifax, it is more expensive, but that includes the outsourcing of the billing. When you look at, we got 3 estimates on just the electronic record itself.
Ask if they get a second.
And Halifax landed right in the middle at around 70,000. There was one other system that wasn't fully developed yet, so they weren't able to get us a true cost, and that was, I believe, more expensive than Halifax. So when you look at the EMR component itself, Halifax lands right in the middle. It just, when you add in the outsourcing and the billing, that's where the estimate looks much different. So you're looking at 2 different costs when you're looking at the proposal, if that helps clarify.
It does, thank you.
Okay.
Is there any time for, what the recommendation would have been, get 3 quotes that are similar?
From me, the recommendation would have been to do a bid.
And
For that amount, anything over 75,000 is, any purchasing agent is gonna tell you, when in doubt, you do a bid.
is there time to do a bid to know that we're getting the,
So the software is essentially extinct November 1st.
it's unusable or can't be supported?
It can't be supported. We're
We're
already
using it
running
in the next
into
month.
barriers with the software. The latest update that they did on the prescriber level has led to 2 business days where prescribers were not able to effectively access the electronic record and do electronic prescriptions. So our concern is the usability is decreasing.
How long does the bid process take?
So because of how long it takes to actually put a legal notice into the Citizen or the Cayuga, you have to publish a notice in there. It's at least 2 weeks before that. So I mean, I can issue one tomorrow, but the public notice won't be for at least another 2 weeks, and you have to have it 5 days beyond that. So you're looking at around 3 weeks for your minimum if you published one tomorrow and
We're talking about coming
set
back,
to
we're
make
talking
sure
about
you're
coming back
compliant.
next month.
I'd like to second it and call the question so we can have a vote.
Okay. At
Do
this,
we vote on call the question?
Yeah, no, you just vote. We're just gonna take a vote.
no, you do vote on
You
call. the
just.
question.
Vote on
You do vote on call the question. Yep.
So who's gonna take the vote? Is it you?
We need a second to Ben's call.
No.
Just vote.
Vote on calling the question.
Ben, I think Ben.
He
did.
essentially wants to stop any further discussion on this and
So call the vote, it's fine.
okay, can we get a vote on HH4?
Are you gonna vote on calling the question first?
Oh,
Yeah,
Yeah, that's.
okay. Who wants to call the question?
No, but you already did.
And I'm not supporting that. Are you?
I'll
I'm
support,
supporting it.
I'll support it.
Call the question?
no,
I think there was more opportunity to discuss, so I vote no.
I mean, obviously, in our position right here, we're looking at a pretty expensive software. And we didn't, you bypassed it for whatever reason.
Yeah.
The bid process was bypassed. Now we're at a junction of, do we have enough time to do that or don't we? And you're saying that you won't have adequate software available?
Yeah, that's our concern. And I think when we were looking at the different softwares, I think the challenge when you're looking at them is everything offers something differently. Some have telemedicine embedded in them, some do not. I think when we were looking at Halifax, it had telemedicine, the video component embedded, which saves us the cost of Zoom. It also has a safety component for our therapists within like a panic button that is included and incorporated into the software, which is something that's really important for our clinical staff, which is also an additional cost that we're spending on with the little green button. And we're also learning that that technology is also not keeping up, and we're having other challenges with that being successfully operated throughout throughout our building. So when we were looking at, I think they looked at 10 to 12 different companies and narrowed it down to 3 to kind of really prioritize what met the needs of our therapists, what met the needs of our medical providers, what met the compliance needs, which is critical, and then what also meets the bill needs. So there's 4 different factions when you're looking at a successful electronic record for mental health. But we're also looking for a company that understood billing in New York State, which is different. I think that was one of the things that was highlighted in our phone call today with Will, who's the sales rep, as well as the unique nature of what occurs when you're billing behavioral health. It's different than kind of some of the physical health and billing as well. So we factor all of those into the decision making and had all of those entities for the review process. And we're kind of going through this process to make sure that all 4 distinct needs could be successfully achieved with one electronic record.
Thank you. Thanks for the additional information.
Is it policy like after 75,000 to get a bid, or is it, why didn't this happen this time? I'm not questioning.
They have the option, they can go to bid or they can get a chair waiver. So they had opted as a department to get a chair waiver, which keeps them compliant with our policy.
No, I got it. I just,
Yeah.
just understanding.
What are you currently paying for software per year?
Or what do you pay the 5 years ago or whatever?
That cost. You don't have the.
Because
I think it's around 78,000 that they paid with their manager, but it is very outdated. They have been using it. And I think they
Since
were,
2012.
yeah, and I
And
think
this-
they were notified towards the end of last year, Danielle, I could be wrong.
And this new software, it says you'll be, be able to fill get rid of one position due to it. You see it taking over, or being able to substitute other staff members physically as well, due to the fact of all the stuff you just described that it does.
It's going to centralize a lot of processes for our support staff as well as for billing. And I think it allows us the opportunity to kind of look at long-term, what is truly going to be needed to sustain the local department. And it could be a position such as a front. So it really allows us to look at the necessity of maintaining a billing department, which is kind of a future goal for us to look at.
Okay. Can we get a motion for a vote on HH4? All in favor?
Aye.
Opposed? Okay.
Ben, you're opposed?
No, I said aye.
You said aye, okay.
It passed through ways. Now we just have the legislative meeting to go through. Okay, go ahead, Heidi.
Okay, so HH11. We talked about this at committee, mental health. Also did some research into whether they would be compliant if they worked with a psychiatrist or a nurse practitioner, psychiatric nurse practitioner. When they found that they would be in compliance with New York state law, a resolution that they had brought forward to us and that we approved in July or August, they have asked to repeal. And that is MH repeal 34624. And it indicates that whereas we made a resolution to fill a full-time staff psychiatrist, we would be there looking at repealing that, immediately abolishing the position of staff psychiatrist.
And what number is that, Heidi?
It's actually HH11.
Okay.
It's placed in
Yep.
there because it's,
Yep.
it'll explain the next tabled resolution.
All right. Can I get a motion for HH11, which,
Move it.
second? I'll second it. This is the one where we're filling the psychiatric nurse practitioner and abolishing the psychiatrist.
It's actually, we're repealing
Okay,
the resolution where we formally were going to
fill
fill
the psychiatrist.
staff psychiatrist.
Okay, all right. All in favor for HH11?
Aye.
Aye.
All right,
So HH5 was tabled to Ways and Means, so that we could have, HH 11 prepared by our attorneys, repealing the former resolution. HH 5 authorizes the creation and filling of one full-time psychiatric nurse practitioner at the mental health center.
I'll move that.
Okay.
Any questions? All in favor?
Aye.
HH 7. HH 10, both of these are fills. HH 7 authorizes the fill of a full-time help staff social worker position at the county mental health center. Well, familiar with.
Yeah.
Now. And then HH 10 authorizes the filling of a full-time crisis intervention care manager position at the mental health center as well. This is the position that is involved with the mobile mental health.
Can I get a motion for H7 and HH10? Yep. I'll move those. Can I get a second?
Second.
All in favor?
Aye.
Okay, we got one more, Heidi, right?
Let's see, yeah.
9.
We have 9. 9 is another resolution to accept funds, authorizing the Cayuga County Legislature and the treasurer to amend the 2024 budget to accept additional OCF funding. This is for our youth bureau. New York State had some counties that did not use all of their funding, and they split that among counties who had. And this allows us to bring in money.
I'll make a motion for HH9. Can I get a second?
Second.
Move it. Second.
Okay, all in favor?
Aye.
Hey, government ops, you got it one added, Brian.
I do, yes, and Fred was at government ops and he described what, and I think if everybody agreed that this could move right on to Ways and Means. GO1 is authorizing the county attorneys to fill an open assistant county attorney position. Can I get a motion?
I'll move it.
Nightingale, second.
All in favor?
Aye,
Doing your job, man, I do it. good,
that's
don't I?
right.
All right, so never know what to say quite after bondage.
That's right. Now we can move on to planning and public works.
Okay, Planning Public Works has 6 resolutions, but I'd like to bundle 1 and 2. They're both. One is for the upgrade to the or tenant work that has to be done. That's 100% reimbursed. And the other is for the chiller maintenance for the AC system in the county office building.
Move 1 and 2 as a bundle.
I'll second. Any questions? All in favor?
Aye.
Aye. I'd like to bundle PPW 3, 4, and 5. We're all basically accepting grant money for the various different things that are going on in planning.
I'll move 3, 4, and 5.
Second.
Nightingale, second.
Any questions? All in favor?
Aye.
Aye. PPW 6, we're pulling. There was still some questions that had to be answered on this one, so that'll come back next month. PPW 7 is for the Visitors Bureau. And again, it's the grant money.
Okay,
I'll move it.
I'll second. This is, yep, establishing them as our designated agency. Is that, yep. Any questions? All in favor?
Aye.
Aye.
Thanks, Ben. Jonathan.
Madam Chair, Judicial and Public Safety has 2 resolutions. I'm going to offer them separately because JP1 needs to be amended, but JP one is authorizing the chair of the Cayuga County Legislature to sign an agreement with Interaction Insight Corporation for the maintenance of the recorder at the Cayuga County 911 Center.
Move it.
Second,
I'd like to make an amendment to JP one. And that's going to be a change of the amount. We're going to change the 10,157 down to $9,457.40, which is additional savings of almost just over $700. They're able to read that quote.
Move the amendment. We do?
yep. So we have a motion for the resolution as amended. A second? I'll second it. All in favor?
Aye. And finally, ma'am.
No, we got to vote on the
I'm sorry, we got to vote for
amendment.
that one, yeah. We got to vote on the resolution as amended.
Move it.
Second? All in favor? Aye.
And finally, JP two authorizes the chair of the Cayuga County Legislature to sign a contract with Motorola for necessary microwave upgrades associated with the 911 system. It's also 100% reimbursed to the CX.
I'll move it.
Second.
All in favor?
Aye.
Job there, Madam
Yeah.
Chair.
There's no other
Motion
business.
to adjourn?
I'll second.
All right,
All right.
thank you. All in favor?
My phone rang right time.
We got it.